Hello everybody, it's Dr. David, the ENT doctor. I often find myself chasing my tail on many things, and this is a video that I had intended to do as a follow-up to a post I did on the whole issue of mouth breathing and big tonsils. And sometimes I do posts where I expect some pushback and some contrary ideas, and this is certainly one that is a repeat offender with respect to that being the case, and that's okay. I think it's really important, first of all, to highlight I'm not trying to tell anyone what to think or believe. I'm just going to tell you what I think and what I believe, but I'm going to now take the opportunity to throw some evidence into that conversation, because ultimately that's what it comes down to. Now, we've got all got our anecdotes, and I've got just as many as anybody else, but I need to talk about the majority of cases, the majority of time, because these are generic posts, nothing specific to anybody, and as a result it's a broad discussion rather than a case-by-case. The case-by-case discussions are the clinical review, the consults and so forth. So general conversation. So think about things in this context. So pretend that you turn up to the scene of a crime and you find two things going on. You find big tonsils and mouth breathing. Now, whatever you find at that particular time has taken time to get to that point. So all you've got are those two things. That's your evidence. And you need to now try and knit together how this crime has taken place. Did the mouth breathing happen because of the big tonsils? Did the big tonsils happen because of the mouth breathing? Or did both just happen and they're just pure coincidence that you've got two things going on at the same time? With that in mind, what you would tend to do is you go, all right, well, let's look at what are the causes of mouth breathing and what are the causes of big tonsils, and is there anything that can guide us as to what the story may be? So when we look at the causes of mouth breathing, 80 to 90% of the time it's due to some form of nasal passageway obstruction, and that can be either at the back due to large adenoids or at the front due to large turbinates, which are usually related to allergy. So we've got some indications there as to the main culprits for mouth breathing. Now we look at big tonsils. Now, historically we thought that big tonsils related to infection, and what we've come to realise as ENTs is that most of what we do relates to one of two things. Sometimes there's both, but if we have a look at the research and the evidence, for example, large tonsils, the majority of large tonsils that paediatric ENTs like myself take out, there's no history of tonsillitis whatsoever. There's no infection history at all, as opposed to recurrent tonsil infections, which is another reason we take them out. And I think this is where people have got confused, because we know that being a mouth breather does cause irritation and inflammation to the tonsils and is associated with infection. But again, infection and enlargement with obstruction are not the same thing. In fact, when we look at the numbers, so for example, the research looking at kids under the age of around about 4, only 2.5% of kids have infection and large tonsils going on at the same time. Kids between the ages of around about 4 to 8, it's roughly about 9% of the time. So in the majority of cases, there is no overlap, okay? It's either one or the other, occasionally both. And I think this is where people might have got tripped up, because the narrative makes sense. If you have mouth breathing and inflamed tonsils, what people have translated that into is swollen tonsils and an obstruction. And that's where people are tripping up, I think. And that's just what I want to point out, that yes, the mouth breathing causes irritation to the tonsils. And yes, it probably changes the bacterial growth within the tonsils as a consequence of just virtue of the different gas exposure, to put it in simple terms. It doesn't make the tonsils get bigger. That's the difference. Now, what have I got to substantiate that? Well, let's go back to the two leading causes of mouth breathing: large adenoids and large inferior turbinates. Let's do the adenoids first. Let's have a look at some numbers. So we pick up large adenoids because of mouth breathing. And when we look at population studies, there's some research that suggests that, and it's really quite staggering, possibly as high as 1 in 3 children, close to 30 to 40%, 1 in 3 children is a mouth breather, potentially because of large adenoids, okay? So we've got that number. Now, what's the rate of big tonsils? Now, if mouth breathing was causing big tonsils, it should be similar. It's about 10%. So there's a disconnect there. So that's our first clue that maybe the link is not as strong as we thought. Let's talk about allergies. What's the story with allergies? Well, if you have allergic rhinitis, hay fever, it's an inflammatory disease. It causes nasal obstruction, leads to mouth breathing. What's the story there? Well, interestingly, it's associated with large adenoids, but it's associated with small tonsils. So we have one clear pathology, and then you can add in the adenoids where it's implicated as well. And whether it's one or both, those tonsils, again, are generally small. So we have another disconnect there. So if we were looking at this from an investigative point of view, we would notice that the mouth breathing, due to either cause, is associated generally with tonsils that are not big. So it starts to corrupt the thinking a bit. Now, another cause of mouth breathing is big tonsils. So you can have big tonsils that obstruct the ability to push air from the nose through the back of the throat, and hence their mouth breathing. So we do know that large tonsils are a cause of mouth breathing. And this is where you've got to look at the evidence in front of you as to how this crime has been committed. And when you piece it together, the missteps I think people have possibly made, in my humble opinion, take it as you wish, is that mouth breathing, although it causes tonsil inflammation, that is not the same as tonsil enlargement. And getting chronic tonsil type infections, for example, is well known as being related to mouth breathing. But again, that doesn't translate into big tonsils in the mainstay. So that's why I mention that in that context, because it can be very tempting to think, well, we've just got to fix the mouth breathing, we're going to fix the tonsils. You might fix sore throats, and often I'll come across people that have a blocked nose, and we do fix the blocked nose, get the nasal breathing, and their throats do come good, which is great. But then there's some that just don't improve, and they end up, needing the tonsils sorted because of those chronic infections as well. But most of those tonsils are not enlarged, they're not swollen. So if you want me to make a concession, or look, maybe sometimes, the mouth breathing may cause large tonsils, and maybe sometimes addressing that may then make them go smaller, which is great. But in the mainstay, in the majority, when we look at the numbers, large tonsils is not related to mouth breathing as a cause. When we look at the common causes, the numbers just don't match up. There's a disconnect there, and there's also a disconnect between understanding the difference between inflamed, infected tonsils and swollen tonsils. Even though both processes are inflammatory in their nature, it's a different inflammatory type of pathway. One's driven by infection, the other is probably driven by the immune system and some genetic background, because we know that upper airway obstruction runs in families. So it's a combination of your genes and the environment. Now, as to the environmental factors, we have focused prolifically on bacterial things and come up pretty blank a fair bit. We do come across viruses far more as a relevant finding, and it seems to be residual viruses and then the body's immune response to those viruses that lead to the swelling of the tonsil tissue, more so than bacterial infections do. So that's it in a nutshell. As I said, I'm not trying to tell anyone what to think. I'm not trying to tell anyone how to think, but I would encourage pauses as to what we think and what we believe. And if something comes along that proves me wrong, hey, prove me wrong. But in the meantime, it's all well and good to have these assumptions, but we've got to test them. And it's not good enough to say, oh, but I went to a course and so-and-so said this. It's like, well, where did so-and-so get that information from? And what's their research and what's their evidence to support it? And if it's speculation, that's fine, but call it as such. And if you don't know, just say you don't know. Much more healthier to have those conversations. So anyway, that is why I would like to present the case forwards for mouth breathing does not, in the mainstay, cause large tonsils. Cheers.